We continue with one of our top stories of the day, the temporary closure of the Charlotte Maxeke Hospital due to the damage caused by a fire. For reaction on that, I'm joined now by Clement, Marule, who is Nehawu, Gauteng's coordinator. A very good afternoon to you and thank you so much for joining us.
Thank you very much, and it's a pleasure for engaging with yourselves.
Now, Mr. Marule, can we get Nehawu Gauteng's reaction, first of all, to the news that just came in recently that the fire has been successfully extinguished, and also the news that the hospital will be closed effective immediately for a period of 7 days?
Yeah, when we started hearing about the news, we were really shocked as to what happened. But as and when the intervention happened, we were really relieved by the fact that there were no fatalities as a result of that particular fire. So we're really worried about that situation. But for the temporary closure, we support that because as the fire has been stopped, the only threat is the smoke. So we were confident that the Gauteng Department of Health is they are hands-on in making sure that that particular area where the fire started is cleaned up. So as we spoke to them before we come into this interview, they assured us that it might not take even the 7 days. They are working hard to shorten even the period of cleaning up so that that hospital is normalized.
And in the meantime, how will this closure affect your members? I mean, the Department of Health did mention earlier on that a lot of the patients have already been evacuated and sort of reallocated to different hospitals. Have the members of your union actually been told which hospitals they'll be working at while Charlotte Maxeke is currently closed?
Yeah, those are some of the things that the Department of Health is busy with. Will be, updated insofar as those particular plans. But there is, allocation of personnel, in particular nurses and so on, to go and assist where those particular patients have been evacuated to. So will be updated by the Office of the MEC insofar as the deployment during this particular 7 days as to how is going to be the plan insofar as the personnel is concerned.
Now, are the staff members who were working at the dispensary or the storage facility where this fire broke out, are they members of Nehawu?
We can't say, we can't confidently say so, but as a majority union in that particular hospital, surely some of the workers are our members.
Well, would you have any information then for us regarding those workers who were present when the fire started? Have they been able to give their statements to investigators regarding what they saw in the moments leading to them realizing that a fire had broken out?
We have not had an opportunity to speak directly to our members or to the leadership of the branch, which is something that we are arranging to get a briefing, because since it has started, we have not had an opportunity to have a briefing by our members and the shop stewards and our shop stewards in the hospital to get a proper briefing of what happened, so that also we prepare them for this particular investigation that we're saying, as we're calling for a speedy investigation. So we're working closely to make sure that we get a briefing with those shop stewards and prepare them for this particular investigation that we are calling to happen as soon as possible.
So would you say that you are actually confident that the hospital will reopen as the Department of Health has promised in less than the 7 days that are stipulated?
That's what we were assured. Before we come into this interview, as I said, we had an interaction with the Office of the MEC, who said as much as they have closed it temporarily for 7 days, but they are working all out to make sure that they minimize that particular period. So it might be even open before that particular 7 days.
Well, we'll leave it there for now. Thank you so much for joining us. Clement Marule, who is Nehawu Gauteng's coordinator.